What's up, everyone? This is Kevin Sunga from the Equity and COVID Health Outcomes team, ECHO team here at Little Manila Rising. We have an exciting wrap-up today. We got Dr. Freddie Ray, the man of the hour, and Quincel Kiambao, the woman of the hour. Or, you know what? It's just people of the hour. That's what's going on right now.
Community of the hour.
Yeah, community of the hour. See, look at that. See, that's why we need him. So we're bringing this here today. This is exciting. I know we've kind of been playing with this idea of doing sort of like a podcast and just for us to talk about. But I think what brings us here today, y'all?
I think, like we do in a lot of holidays, like the holiday season and things like that, at the end of the year, it's always good to reflect. Yeah. Think back, look back at how we've grown, what we've learned, and what to look forward to in the future.
I love that. It's about reflection.
And sharing the narratives that we hear from our community, echoing their voices.
I see what you did there. So I guess we are that's beautiful. Like we are reflecting, like we are echoing everything that we have learned. And I know this series kind of began as an experiment. We started this, and before we dive into it, I think we got to know who's at the table here first. I failed to mention that. What's up, everyone? Again, I'm Kevin Sunga. I'm the program director for the Equity and COVID and Health Outcomes team here at Little Manila Rising. We're primarily the COVID. We act as the COVID response program here at Little Manila Rising, increasing COVID vaccine and testing sites and educational opportunities to promote vaccine confidence. I definitely couldn't do it here with some important partners. And I'll hand it off to Dr. Ray. Well, thank you.
Hello, everyone. So my name is Dr. Freddie Ray. I'm a full-time critical care pharmacist. A lot of the specialties that I work in include neurocritical care, which is things like strokes, head bleeds, things like that, trauma, so motor vehicle accidents, med surgical ICU, so critically ill patients with infectious diseases and other sorts of chronic diseases, and also COVID. So I have experience working with COVID patients, both in the medical surgical and also critical care acuities.
It's beautiful. That is tough. No, that takes a lot of expertise, and we really appreciate you just joining on for this.
Of course, I love coming on with the Little Manila ECHO team just to talk about COVID and our community, answer any questions that the audience has throughout the year, and just be here as a supporter of the community.
Thank you, Dr. Ray. And last but not least, we have another very, very important healthcare worker here, and also part of the ECHO team, Quincel.
Hi, I'm Quincel Kiambao, and I'm one of the events and outreach coordinators with the ECHO team.
Awesome. All right, this is the all-star cast, and we also have other team members, John Collar Shabauer, and also Koji Lewis, and we also have some amazing program assistants. Shout out to Joelle, Josiah, and Angie for really promoting the work here on the ECHO team. And Haley. Oh, that's my family. I'm so sorry. Oh my gosh, that's terrible. So thank you for all the hands that have created this series and have been a part of it. I think that's such a beautiful thing. And for us to take the time at the end of the year to really reflect, as you've mentioned, Freddie. And something that I really wanted to have space to talk about is like, what brought us here? Like why are we here? Why are we doing the work that we're doing? So I guess like the audience, as sort of a recap, can understand where we're coming from. If anyone wants to join in, this is the fun part. Yeah.
I would say that we're here to bring vaccine confidence to the community and also continually educate within like the upcoming year. Yeah. And I know we're in this like triple-demic season right now, so it's really important to do that for the community.
Exactly. I just want to say, first of all, thank you for the opportunity for taking me on your journey to help the community be educated about COVID and all the updates that are happening, on a daily basis, on a monthly basis.
Of course.
I think what really brought us together what brought me to this point, if I can share, I guess, is just what happened to me becoming a pharmacist. So a lot of my inspiration to become a pharmacist was the fact that when I saw my mom picking up her medications at a local Safeway, S-Mart Foods, the pharmacist was there just giving advice to people, putting smiles on people's faces, and just being someone who's super accessible.
Yeah.
And I hope that my presence here in the LMR community is just someone who's knowledgeable in healthcare, but can also bridge the gap between those in the community that need someone who's easily accessible that they could ask questions to. So it's definitely why I'm here and why I'm glad to, be a part of the Echo team as like a guest. So thank you very much.
Thank you, Freddie. You both, I just wanted to shout out like in your own, because Freddie, you work critical care pharmacy. Like, that's such a beautiful story to know like why folks dive into clinical. I mean, being Filipino, hey, nursing track, yay. And like they play such an important role. And something to note is the holistic type of care that is needed to take care of patients, to care of the community. And so the education that you provide, Freddie, very grateful. Quincel, I know this is a hidden secret, but you still work as a scribe part-time at Adventist Lodi Memorial. And, we really appreciate that because, like, you document the notes. You make it so community can understand their own health through their care. And so, I guess to share what brings me to the work, is I'm a very atraditional, like I wasn't into nursing. A lot of my families, shout out to all my cousins who are nurses and everyone all my titos and titas, and doing great work, especially during the pandemic. But for me, like I took a lot of interest in policy, and I didn't know that I would be pursuing the health track, but I had the opportunity of working at UCSF Medical Center, in the admin capacity. And while I was working there, I worked in oncology, so a lot of cancer departments. I saw the inequities of patients that were coming from far. And a lot of them coming from the Central Valley, which is very ironic. Like we're here now treating, we're helping community members who are from here, and we have a chance to make a difference. So I think that's where a lot of like the fire and the passion that comes from me.
Nice. Thank you for sharing, Kevin. Yeah, I think to kind of bring it full circle, whether you're in the direct patient care part of healthcare or the sort of politics or the legislation and all that stuff, it all kind of comes together. I mean, healthcare doesn't work if all of the cylinders of the engine, so to speak, work, or the whole team is working together. Yeah. And it takes, the public health sector and the on the floors sort of team, and also the people making the big decisions at the top to kind of come together and realize like, hey, healthcare is a multifaceted sort of a work environment. So, yeah. I mean, it takes all of us really to help patients in need. So like definitely like we're in a good place.
Definitely. We're making it happen, from community health workers to the clinical teams to all those like admin supporting, like just big shout out to everyone that is doing the work. Like we're just a piece of it. Snaps.
Yeah, and I feel like as Echo, we're we play a huge role in preventative care as we build trust with the community. And like coming from the ER setting, I think it's really important for us to find ways to not have them go to the ER and to be like on the ground and to educate them and also like have them be a patient advocate for themselves.
Exactly, which is kind of like an ironic thing. It's like, well, people come to the hospital where I work, where I, have to work on patients, but the goal should be to prevent these patients from coming to the hospital.
Yeah, even though we work there.
Yeah, exactly.
Don't come here.
Sorry, we're trying to cut the business of the hospitals. Just kidding. No, but that's the intention. That's the weird thing about healthcare. Yeah, exactly. In that way, the preventative care. And, I think that's a good segue into reflecting the year. And I think one of the largest purpose of this was to break the barriers between trying to access a trusted clinician in the community, and then for us to be facilitators for this. And so that's what the IG Live series. And so, I would love to talk about how this year went. It's been a couple of months since the beginning of the year, right? Like we actually started it in January.
Yeah.
Oh yeah, we did. Sorry. Yeah. Quincel came.
Oh yeah, I was like later. July.
You're like, yeah.
This has been a crazy journey. Little Minilly reached out to me through Elaine, one of my good longtime friends, to first do like a town hall back in October 2021. And then that kind of spiraled into this more bigger conversation with Kevin back in, I think, was it January? I was like looking at my notes. We were like, okay, we have to talk about Omicron because everyone's kind of freaking out. Yeah. And so Kevin brought me along and he's like, hey, I saw you do the town hall. We should do another, I guess, was kind of like a town hall. It was like a Zoom thing.
It was like a webinar of some
A webinar.
Yeah.
So we went from webinars to all of a sudden doing IG lives, and we're like, this is a population that we could hit.
Yep.
And they're like, we went through like IG lives and kind of started the conversation with a lot of people who've never heard of me, never heard of any of us, and now we're like we talk all the time, every couple of months or it's 2 times a month.
Yeah.
About all kinds of stuff, and it's really grown to like have like a whole like close knit sort of community. I think a lot of people have shared a lot as the year has gone on.
Yeah, I think that is like that's a huge reflection for us. Like, it started off with just a dream. Like, it started as a deliverable. Let's start there. So with our funders, we're here in nonprofit, like we're contracted to do work. And so, but then, like sometimes we have to think about like, what is a creative way that we can engage with our community? And so, we did town halls, very effective. And I was thinking of like a low commitment way in order to engage with our community. And they could just stop by, because we acknowledge that folks in our community, they're constantly working. They're coming like late hours. They don't necessarily, they have access to Zoom. And so social media is its own thing. But, we're exploring, and that's why we're doing podcasts now. Like, we're exploring this avenue, and it just keeps increasing. So, no, thanks for shouting that out. Like, we're trying to be innovative in the way we deliver education, and to break those barriers.
And with education, I think that we've come a long way as far as not just delivering it, but also sharing education. Totally. I mean, you think about when Omicron first hit, the United States, and people were kind of freaking out. Are our vaccines going to work? Like, what do we do with the CDC guidance? Like, we shortened it from like 28 days to 14 days to like 10 days by the beginning of the year. Mm-hmm. So I was kind of thinking about like, okay, when does my actual like day 5 end? Or what should I do with the boosters? Do I need to get the boosters now? Yeah. And that was all stuff that we talked about back in January. Yeah. And to think about it, we're still talking about it now because there's the need for education just continues to grow, which is kind of crazy that we're in like year 3 of the pandemic, basically. Yeah. And a lot of education is, still needed. Yeah. But, like some of the things I just wanted to highlight that we've talked about, what's the difference between COVID and the flu? Like, are they the same thing? Are they actually the same thing? Like what people say in different news media sorts of things? Like, is COVID like a mild flu? And, what are the symptoms? Can we identify it so that way we can figure out, okay, we need to quarantine that person or not? How to do tests. I mean, tests are a big deal, and you would be surprised at how many people took COVID tests or, got their free COVID tests at home, but didn't really know how to use them. And it would be, false negatives and all that sort of thing. So we did all kinds of education like that.
Yeah. There was new technology coming down the pipeline too. Like, we had PCR tests. You normally would have to go and get swabbed, and it would be run through the PCR, like clinical laboratory. But then home tests started to happen. And, there was education around that. The pandemic was so dynamic in terms of what we talked about. So I think this was very necessary to have frequent engagement and education of the how-tos, the CDC guidelines. Everyone gets confused. Like, it is what it is. It's half and half, like somewhat easy to navigate if you watch the news and things like that. But if you never like keep up with it, which is totally fine, it's hard to know what exactly you're supposed to do. And even it's evident in this month, like in the last week, like figuring out, okay, when do I stop quarantining, blah, blah, blah. Yeah. All that sort of thing. And I think we really brought those sorts of hard questions to ask, like that people don't know the answers to the table multiple times. And I think that was pretty good. Yeah.
Yeah, and I feel like the information is ever evolving, and I think the community noticed that there's so much information out there, and I think we did a good job of picking the most important information to share, so that way people don't experience information overload, because that's a huge reason why people are not really enticed to learn about the new updates, because they're like, oh, it changed again, after a week of them saying oh, you have to quarantine for 14 days, but now you can do 10 days now. But yeah, I think we did a great job of updating the community in a timely way.
Yeah, no, that's exactly the point. I mean, people get overwhelmed. Everyone has their own lives. Everyone, works, 8 to 5 or whatever their schedule is, and it's hard to keep up. Not everyone's in front of the TV all the time, or has, works in healthcare all the time. and even healthcare professionals, utilize the LMR podcast and IG Lives to help them.
It's good to know. Okay.
Yeah, so I guess like short story or long story short, but a lot of my colleagues in the hospital, like even in the ICU sort of setting, who work with ICU critically ill COVID patients and all that sort of thing, weren't really getting the same updates or weren't really keeping up with the updates as fast as like I was, because I was really in it and like doing the research and listening to, the team with Fauci and, the WHO team and all the World Health Organization, all that sort of stuff. So a lot of people in the health professional field, got a lot of benefit from our IG Lives, which I thought was pretty cool. And they told me afterwards, they're like, wait, you and your husband, who's also a physician who treats COVID patients, was like watching our videos? I'm like, yeah, we watch it all the time. I'm like, whoa, that's crazy. Awesome. Yeah, I think that's a big thing that was really inspiring to me to come on to do more IG Lives with you guys and to like be excited about it, is because we're actually making a huge difference, not just for the Stockton community and San Joaquin community, which this all kind of focalized from, but we're making a difference in the digital community.
Oh, I know. I joked around that we're content creators.
Divide.
I know. Are we part of the problem? No, I'm just kidding. Yeah.
But
no, you're right.
It's there's so much misinformation and all of that, and to have an extra like resource like Echo Team Little Manila, just to be there for those who relate more to like our culture and things like that, or even just like want a different source that's refreshing, that's not necessarily like the whitehouse.gov website or CDC or the news or something like that. I thought it was super beneficial. So
I think what was really effective is that we have the perspective of on the ground, in different settings too. Like for us on Echo, like we work directly with the community members through our vaccine clinics. We do a lot of outreach. That's one of our strongest activities, and we use different methods of outreach. We do community canvassing, so we go door to door. We be in public places, and I think what we're really trying to be conscious of is, instead of like, we want to educate and we want to promote that, but also what can we learn? Like what can we learn from our community, and what can we like tailor that education to? Because everyone, learns differently. And also shout out to those who are working, like you work directly in the COVID unit. Like you work directly with COVID patients, so you knew the impact. Like it wasn't just, a secondary source, like you saw it firsthand.
Exactly. And I think like putting those hand in hand really is like what we just talked about a little bit earlier. It's like it takes all of us to kind of figure out what to do for the community. But yeah, I think that kind of looking back, we made such a big difference, and I'm just grateful for the opportunity. And I think like a lot of people are grateful to have you guys and all of these IG Lives and podcasts. So
thank you. We work for the community, so it's whatever the community wants and wants to hear. We'll always be here. And so that's a really kind affirmation and that reflection. Wow, it makes my heart warm. I'm gonna cry. Like, dang! Oh, this is like my Christmas gift.
It's our first podcast. Kevin cries.
If there's a crying laugh track, I'm down for that too. I know, right? We have those buttons.
Yes. Yeah, I think before I started with Echo, my first introduction of Echo was actually the IG Live you had with Koji. And you guys talked about like, what is it called? How to quarantine and how to like do it in a multi-generational household. So things like that. And then I met them through like a tree planting event. So yeah,
that's crazy. I'm so glad that was impactful to you. Koji and I and Kevin, we were kind of going back and forth. This multi-generational idea, like that was on. For those that don't know the behind the scenes, we have this huge Google Doc.
Oh yeah.
We've been planning for like months all of these topics.
27 pages.
But because we talk about so much stuff and like include our audience in IG Lives, we never get through we never get through our full list of topics, which is kind of funny. There's so much to talk about just everything, community, COVID, and all that stuff. And we finally got to that one topic about multi-generational families, which we're like, this is like something that no one talks about. Yeah. It's like, all right, everybody gets vaccinated or not, everybody, masks and all this, but like, what do you actually have to do, like in a household where, like, let's say you, the primary like person working in the household, gets sick with COVID? Like, how do you navigate like your titas or lolas or lolos not getting sick? Or like, what do you have to do at home? What if you have a little kiddo in the house? How do you protect them when you are the caregiver for the kiddo? Like,
Yeah,
right? Like
everyone
that
had
stuff
COVID.
is so difficult. And so I'm glad that really hit a tone in your yeah. So
It's like, it's really cool that we bring the cultural component of it too. Like, it's not just here's the vaccine, boom, but what does it mean for your household? Like, like us, Filipinos, we like to gather, we eat our lechon or lumpia, all the good stuff. So
We eat with our hands,
Yeah,
so
that's-
it's like hand washing is important.
yeah, oh, that's a
Culture.
good. Maybe we should spend another IG.
yeah, guess what?
This is how you wash your hands.
Welcome to our brainstorming session. Yeah. But there was a lot of, on that topic, like, we're culturally sensitive, but we're on top of it. I know we covered a lot of advancements that happened in terms of the care. And I know we have our notes here. So this is just like seriously 1 out of like 50 pages that we have to review before we do
And
IG
honestly,
Lives.
I think we're only at like the beginning.
Yeah.
We haven't even
We
hit
didn't
really.
even talk about the other.
Yeah. no,
We're
This
just
is-
getting tired.
it's very bare, and it's really cool because a lot of I would say that we've gone a long way in COVID. We have now pediatric vaccines. We have COVID treatment, which you're more well versed in, the Paxlovid, and right now the bivalent vaccine. And so, primarily us, the vaccine work is what really impacted us. That's what we've been doing, and just reflecting. Like I ran the numbers, and we've had about 30 at least 30 to 31 vaccine clinics for this past year.
Wow.
So, and I shout out to all the partners too, to allow it to happen. And with that, we've helped vaccinate at least 1,500 people.
1,500?
1,500.
Wow. Oh my
Yeah.
gosh.
Thank you. I don't, and I
1,500 divided by 30. Anybody?
everyone, yeah.
Do the math.
Yeah. And usually at
Wait,
this
in
window
our
here.
last event, we vaccinated 92 like 2 days ago. So
oh my God.
add that into
Dang,
the
okay, I didn't know that. That's the,
That is really inspiring too, because you hear in the news, like this morning, like I was just watching the news because I was at home chilling, and a lot of people, or the sentiment is that a lot of people are, not getting vaccinated with the bivalent booster or anything like that.
Yeah.
But the truth, not saying the truth is, but the actual eyeballs on the ground today is that people are still getting vaccinated. People are still learning about COVID. It's kind of like a wave of education. It's like playing a big game of telephone with billions of people.
Yeah.
Like the education is still coming down the pipeline. And so that is amazing.
Yeah.
And it's going to continue. You think about it, in a couple months from whenever this video is posted, more people, you're going to have more health fairs. You're going to have more people getting vaccinated. So it's just like perpetual sort of like benefit for everyone. So that's really cool. Thank you for sharing.
Yeah, and then even like some providers in the ER, they didn't even know like kids are eligible, like the eligibility for it. I was like, oh, it's 6 months now. And then they're like, oh, I thought it was 5 years old. And I'm like, well, according to San Joaquin County Public Health Services, it's actually this. And then they're like, okay, we could start promoting it in the ER then too, like the accurate information. So I'm able to use like echo work into the spaces that I'm in, and I'm grateful for that.
That's really cool. So this little dream that Kevin and a bunch of other people in LMR had has now turned into this I don't know like I want to like at this epic sort of like impact. I don't know. And you get people from the digital part, from the actual clinical part, like being impacted by the work that you guys do. And this is really crazy.
It's beautiful. It's like everything compounds on top of each other because we can't do one without the other. So like when we do our vaccine work, we can't leave out the education. With education, we can't leave out with the direct service that we can provide. And so I think that's just an immense blessing, and for everyone to be receptive, and for the community to continue to be engaged. It's really tough. Like it is really tough to kind of get the word out there, but we've made it happen, and it had to be with a lot of the partners and I got to shout out the community for being open to all that.
That's really awesome.
Yeah. Man, that's a lot of reflection. I mean, like, no, it's beautiful. I know, like, we're off.
We're totally off script, but
Yeah.
I think we're showcasing a lot of things that we didn't even think about. Like we made this script, but what we're really showing is the impact that Echo has had this year is way bigger than we thought individually, and it's just going to keep getting bigger.
Yeah, we're gonna keep. We're gonna be doing more work, and you know, I think you brought up a good point earlier. Like, it's not a time to be complacent. Like, you know, the community still needs to continue to be supported in this way. You know, it's not just a one and done situation. Like, even though the narrative is overall like COVID is starting to ramp down a little bit, and especially with the services, like funding is getting pulled away. You know, for direct services like the vaccine work and also testing. But, you know, there's still a lot of recovery that needs to be done. And so, I mean, well, something that you know, have space is long COVID. That kind of intersects all of our work together. You know, more so, I mean, we talk about COVID, but this is sort of like the next is addressing long COVID. And, you know, like you see it in the ED, you see it in your area. So there's a lot that still needs to be done.
Yeah, I think as we continue to evolve with and without COVID, and thinking about the after effects of people who've gotten infected with COVID and long COVID, and how that affects our communities in other ways, and challenges people who may have chronic diseases or people in their daily lives. You know, you think about like people who are still having brain fog months and months after they get a COVID infection, or those who are in the cooking or culinary industry who don't really get their taste and smell back. And now that's a challenge. How do they do their livelihood, right? Or you talk about patients who have asthma, COPD, all these other sorts of populations that, even though initially maybe asthma and COPD aren't high risk groups for COVID infection, the after effects of someone who's at risk of inflammation from their lungs from asthma anyways also has other sorts of backlashing effect from COVID that people don't really talk about or know. And that goes the same thing for diabetes, hypertension, all of these sorts of diseases that get affected and worsen during a COVID infection, but can also have possibly long-lasting benefits, or at least longer-lasting benefits than a simple, you know, with a cold. After a few weeks and you're over a cold, your other chronic diseases aren't super affected. But with COVID, the research is still being done to figure out, you know, how long is someone going to suffer, quote unquote, from COVID sort of symptoms after COVID infection for these chronic diseases. So more to be said on that, definitely.
Yeah.
Yeah, there's still a lot of research going on about it, but the folks that I've met in the ER who have had COVID multiple times, like for example, if they've had asthma or COPD, like they're winded way more. And like I've met folks this past week who are both test positive for like RSV and COVID, and even like younger kids who like experience brain fog, and their parents are like, I don't know why he woke up confused today. And then we test them and they're like, oh, he still has COVID, or now he has COVID and RSV. So there's still a lot of research that need to be done.
Exactly. And that's going to be the challenge that Echo Team and the community is going to face. It's like, how do we balance all of these things? We can't necessarily stay in this pandemic state forever, but we also need to figure out a way out of it.
Yeah.
Right. And how to like cope with it. And that goes for even like the mental health side. So that's another thing that also doesn't get talked about too much. But it's something that needs to be addressed too. It's, you know, you have like people who have to isolate for 10 days. You think about the impact on someone's mental health at that point. And that's in addition to all the other physical health issues that happen. So that's something to explore as well. And in addition to that, the added stress that even though we're in this sort of transitioning period from like COVID being pandemic to endemic, you're still thinking about new variants. We have, you know, the XBB variant still out there. We have, I can't even think of it.
Yeah,
There's
like a BQ.1. Like,
oh, that's right, the BQ.11. Yeah. So, all these sorts of variants that are still coming, which is, you know, we talked about in many IG lives. This is expected because, you know, RNA viruses mutate pretty fast and easily. But we have to think about, like, how is that going to affect our community? Like, in the news today, a lot of people are saying, hey, you know, like, maybe we should reconsider our holiday parties and stuff like that. And I'm like, well, yes and no. And, like, how do you, like, navigate that with, like, again, with multi-generational families? Or as Filipinos, we have family gatherings all the time, you know, so it's, or weddings or any sorts of gatherings. Like, how do you navigate that? And hopefully those are things that Echo Team can also help address as well, and as along with the other issues with COVID and other things going forward.
Yeah, there's a lot of lived experiences. Like, just to share a little bit, like recently, like my fiance had COVID, and so she took Paxlovid. So luckily, we have treatments available. Yeah. Like I think we're like we're in an improved state. I would say we're not totally out of the weeds yet. But her and I just bought a house, and she got COVID, and we had to isolate. And this was the first time that we had we have our own space together, and she had to be in her room, and it felt like the loneliest thing in the world. Like, it was sad. Like, I would have to, like, I'd make her dinner. I'm like proud of that. I'm proud. But it's like having like to do that for, I know like it's 5 days, but she's more on the cautious side, which is totally fine, for her. And it's like, 10 days of just being alone. And I had to navigate that, go to work, and it felt pretty monotonous. And I can only imagine for the families who don't have who don't have support. Exactly. So the mental health, you're right. Yeah. The recovery is not just, talking about all like the COVID and, the physical treatments that are available, but it's taking care of like the person as a whole, like mental health. That's a huge thing that we want to shout out.
Exactly. Yeah. I mean, and then kind of like moving on to other disease states and just kind of like sentiments in the community that have stemmed from COVID. So a lot of people lost trust in public health. And with that was like going to see like a primary healthcare provider regularly, or even getting your annual flu shot. I think this is one of the lowest years. I think it's like less than 40% of people got the flu vaccine this year. Oh, wow. And that's coming in the middle of a time where we're in what people are calling a triple-demic, and basically just that the flu and RSV are kind of taking over now that more people are immune to COVID. Yeah. So that's another thing that ECHO team will hopefully help provide to the community, is more trust in public health.
Yeah.
Right. I think that we need to kind of pick up the pieces. All right, COVID, everyone's kind of freaking out and panicking. Like, okay, everyone stop school, start masking, stop seeing each other, and get this vaccine now, even though it's quote unquote like emergency use authorization and all the other stuff.
Yeah.
A lot of people who are questioning things already, or we're not sure about the healthcare field, have lost trust in like public health. And I think that what we need to continue to do with COVID and other diseases is kind of, educate people more on like why it's important to get a vaccine. Why is it important for someone who just recovered from cancer or has like asthma or something like that to get your flu vaccine? Yeah. Even though flu is something that most people will survive from. Like, what's the difference? What's the nuances? Why should I protect myself from the flu if I know it's not going to kill me, but also it could potentially kill someone who's more at high risk and that sort of stuff, and kind of navigating all of those things. So. Yeah.
And I think it just requires a system, like, in looking at our coast of the work, and I really appreciate you highlighting like what the focuses are, like what are we looking forward to in the future? And, we as a team, we talk about like sort of this recovery state, and it's looking at policy systems and environmental change. And so that's going to be a lot of our work. That's going to be guided by the community. And so exactly to what you said, like what are priorities, what should we be looking towards in the future? And I guess, what are we looking towards in the future? And I would definitely say it's working more with the community. And to continue increasing like, the vaccine confidence. And you mentioned that it's been one of the lowest rates for flu vaccine. And for us, we started implementing more flu vaccine clinics, and we started actually strengthening partnerships with local health providers like San Joaquin Health Center. And so now we're shifting towards like, it's a similar modality. It's not just offering COVID vaccines, but we're also trying to increase vaccine access in general, because that's what helps create, a safe community. And also like, primary care access to try to make it free to serve those who were disinvested and marginalized. Yeah.
That's definitely a good focus for the next incoming year.
Yeah, because our last event, we had over 50 folks get vaccinated for flu, and they weren't eligible for their second booster yet. So I was like, you guys should just get the flu vaccine. They're like, do we really need it? And I was like, this is why you need it. And they're like, okay, I'm going to get my whole family vaccinated. And then some of them got their monkeypox vaccine as well.
Oh, wow.
So, yeah, I was like, that's cool.
Wait, you guys do monkeypox vaccines?
More recently, yeah.
I didn't.
Oh yeah, I
Just kidding,
asked SJHC. I was like, can y'all bring it? Because I mean, it is a thing still.
It is still,
I don't see it like rampant, like in the ER,
which is
but
it's
I
definitely a
just saw one
good
last
thing.
week,
I
so.
think that
Yeah.
another thing, I guess I was just listening to a different sort of podcast about like how do we make everything that we have with like our COVID technology or all of our vaccines and stuff, how do we make that more like effective? And again, it's like targeting those specific populations that are at high risk, like high risk individuals, for instance, for like COVID. And then like that's a good, I like bringing that back to monkeypox, like targeting like those high risk populations that might be more exposed to monkeypox than others, healthcare workers and that sort of stuff. It's definitely something that will be a focus or should be a focus on going forward.
Idea, and I think that's, as a team, like moving forward, looking into more targeted. We can't just blanket share, just general information, like really specific honing in to, it's honoring the mosaic that is our community. It's, it's all the differences, and it's tailoring it to that, like for example, we talked about multi-generational homes. It's not just cookie cutter. And I think that's what's going to help us build trust. Like that's what you're saying, like that's how we build trust with the community is listening to them, and it's to go there and give them the specific information that they need.
Wow. Can you say that? Was that, did you say mosaic?
Yeah, the mosaic, that is the community.
Ooh.
That is.
I was just going to say risk stratification, but that seems
Yeah.
way more, that seems way more beautiful.
I like that. The
But,
stratification is beautiful too.
Yeah, I think that definitely that should be a focus going forward.
And increasing health literacy. Something
Yeah. Oh.
I
Talk to us
Imagine.
more. Like, there you go. Health
I would say
literacy.
like through education, we would be able to help the community become their own patient advocates by like increasing health literacy and simplifying the medical jargon that we receive like in clinical settings, and like simplifying it for them so that way they can address their needs to their provider. Like, this is the symptoms I have, and this is what I was told I should seek help for. How can I go about that? Is like how I envision our team moving
That-
forward.
Is something that we really need to do more. Like from every aspect of the healthcare system, health literacy is lacking. Like, most people in high school, their only high school requirement for health is like a health class where they learn some of the basic stuff. And that's the only time most people will ever listen about healthcare unless they have a disease or something that their doctor has to like kind of like think back to when they were in medical school and think like, okay, how do I explain this to somebody?
Yeah.
Right? So it's like that's another good avenue to focus on too, going forward.
I'm very grateful. There's, we've just talked about a lot of things, like where are we moving forward, reflecting about COVID, what it's meant for us as service providers, like as service providers, as community health workers, what it's like to work in the community. And then, what is our work looking like moving forward? And so I just want to really reiterate how thankful I am to be in this space. It's a very unique space, I have to say. We're breaking, like the traditional sense of like, you go to your doctor, you go home, and that's about it. But for us, how we work together is, you see someone in the ED, or you have a visit with your primary care doctor or a specialist. You go home, but you have people in the community like continuing to follow up with you. And I think that's something that we offer, and I think that's just that's such a beautiful thing.
That's definitely beautiful. And on top of that, we give a place for people who don't know who to talk to about anything, like a place to like speak out. Like one thing that I kind of want to reflect on is as we've done more IG lives, one, the audience has been growing, which is totally awesome. And it's like, oh, hey, I remember seeing you from the last one. That's cool. But they also share their experiences going through COVID. And one, that's like a really good educational thing for other people who are like maybe relate to that person making the comment. But it's also a way of like catharsis or like releasing stress.
Oh, yes.
And I think that, people are actually listening.
Like how do we destigmatize discussing about COVID?
Exactly.
That's a huge thing for us, because when someone when someone coughs, there's like this shame, like oh no, oh my gosh, it's the end of the world. Yeah, but it's like, but what if that person does have a respiratory disease? What if? And so we're stigmatizing that, and so hopefully that's what we're going to work on in the future is destigmatizing the conversation around COVID to make it more commonplace of like this is the steps needed for healthier outcomes.
Yeah, and you're not alone in this.
Exactly.
Like reminding them
Wow.
that
You're not alone.
you're not alone.
You're not alone. That's deep. Sorry. And
Even though you do have to isolate for like a certain amount of period, but yeah, you're not alone.
You're kind of alone.
But your resources are
there.
always there.
Yes.
Yes.
And you always have
Yeah.
Trauma X to message or
Yeah.
the Echo team to message.
Yes,
Like I say in every
actually.
IG live. And I've gotten people after IG lives message me like, hey, blah blah blah, this is what's going on with me, like help out. But you have a team, aka all of you guys,
all of
like
us.
who
Yeah.
know stuff or who know
Yeah.
people for you to reach out to. So like kind of going forward, just like something to think about too. Like you have a support group even if you're alone.
You have a support group.
Temporarily
Yes.
alone.
Temporary
Temporary
alone. That's going to be what this is called. No, I'm just kidding. And that's something that we're still figuring out. So, yeah, I mean, I hate to wrap it up here. I know we've had a very fruitful conversation, and now, we've discussed a lot about what's moving forward. And I'm, happy to say that, we're going to continue doing the series. Now, we're booking sessions. Like, this is the series. We want to continue this, and we want to do better about knowing, like, what do you want to know? What is something that you want to learn? We have Dr. Ray, amazing. We have Quincel, JC, Koji. We have the whole LMR staff here with us, to address from asthma mitigation, mental health. We're doing climate resiliency and climate justice. Everything, plays a role in creating a healthier community. It changes your environment, changes the way you think. And so that's what we want to promote. So we have, I think we're guaranteed like 5 to 7 sessions. Ooh. Yeah, we got more monies. So some more shmoney, the shmoney team, to help this keep going for the community. And something that we're very proud of. And so, we've done IG lives, but we're exploring this setting. Yeah. Like podcasts, that people can visit, that you can listen to when you're on your way to work. Like again, it's very low commitment.
Right, exactly. Yeah. It's just like more education, like more power to you. Yeah, exactly.
Yeah. And that's what we're hoping for. Yeah. And I know, like, before we head off over here, I want to give you, Freddie, like, your plug. Like, you've worked with us. Like, you mentioned Trauma Assist, RX. Like, tell us what's going on and what do you have going on yourself?
On the side of being a pharmacist and helping LMR, I do have a few social media platforms such as YouTube, IG, and TikTok, and it's under the at TraumaAssistRx, and hopefully maybe we could put something, or it'll be tagged. But basically, like and subscribe. No, my goal with TraumaAssistRx is to basically help with health literacy, help with educating people about things that happen with COVID, not just COVID. Hopefully I can expand more to other things that pharmacists are trained on, other disease states, how to take your medications, what to do if this happens, AKA if something happens to your family member in the hospital. What can I do to gather in for more information? How do I take this certain medication, what to look out for, how to take your blood pressure. A lot of people don't really know how to do that. And as a pharmacist, I'm equipped with all those tools. It's just a matter of trying to present that to the audience. So, follow me, like and subscribe. I'll have more content out in the near future, along with more LMR stuff that I'm kind of backed up on, but definitely a lot of good education coming out through the channel. And I'm just a good source for anybody who has any personal questions and things like that. You can always consult me and just send me a message through IG, and I can direct you like a pharmacist would in the right direction for your healthcare needs. So reach out if ever you guys or the audience ever needs anything. Definitely open to helping those in the community.
Cool. Thank you, Freddie. I'd love to learn how to do my blood pressure accurately because I like beefsteak and sinigang. Yeah, I know. It's getting to dinner time. It's time. And before saying our official thank yous and just wrapping up, this session, I just want to give you now space, Quincel. Is there anything that you want to share with our audience or anything that you're doing specifically?
I'm just really grateful to be part of this group and to be part of this space.
Thank you. Thanks, Quincel. And we're likewise, you joined in on, so for those, for Quincel joined a little bit later. like around July, one of our newest team members, but one of our strongest team members, coming into it. So like the experience, like it shines even before coming over here. And really shout out to you and all the great work that you do. Yeah, you're welcome. And yeah, I just want to say, I keep saying thank you to Freddie, to Quincel, to the Echo team, to everyone here at Little Manila Rising, to Dylan, and to our late co-founder, Dr. Dawn Mabalan. Her story has been the inspiration of expanding to health equity and doing more health programs. And again, like, thank you to everyone that's helped fund the work and making all this possible. California Department of Public Health, Together Towards Health, Public Health Institute, Sierra Health Foundation, San Joaquin County Public Health Services, and San Joaquin CMC Community Medical Centers. There's a lot of people. And also San Joaquin Health Center. And if I missed anyone, I'm really sorry. There's a lot of acronyms, but I just want to say thank you to everyone that's helped. Urban Institute, for also CDC for just supporting us in the work and making sure that we get the information out to everyone. So yeah, that's pretty much like that. This is the end of the year.
Wow, we've come such a long way, and it's honestly just the beginning.
It is.
Well, thank you guys so much for the opportunity to work with you. I'd love to work with you as long as possible because this is so fun. Yeah. It's so fun. So thankful for the opportunity to be here, to be part of the community.
Of course, and we're going to continue, and we're excited for what's going to happen next year. Join us for our future lives in whatever platform it's going to be. Just want to say thank you very much for tuning in, and we're signing off for the season. Take care, everyone, and have a happy holiday and a new year. Music.